Sfurti is going to be presenting a case on Plateau virus.
Good morning. Today's topic is when the plateau steepens, a case of plateau iris syndrome with key takeaways.
Doesn't matter. It's okay.
When the plateau steepens, a case of plateau iris syndrome with key takeaways. Okay, plateau iris configuration includes narrow angles and a flat iris plane. Also includes an anterior rotation of ciliary process which may lead to the angle closure. On gonioscopy, we can also see double hump or sigma sign. So, a 30 years female presented with chief complaint of sudden painful progressive diminution of vision associated with headache and redness in both eyes since 3 days. She was a known case of glaucoma on 4 anti-glaucoma medications, had a past history of spectacle use, had a history of both eye laser PI done 3 months back. On ocular examination, her distant vision was 660, improving to 636 with pinhole, with plus 6 diopters sphere in the right eye and plus 4 diopter sphere in the left eye. On slit lamp examination, anterior chamber was shallow with VH grade 1. Both eyes patent PI marks were present, and both eyes had pinpoint pupil under the effect of pilocarpine. And on GAT, the pressure in both eyes was 24 mmHg. Also on fundus examination, we can see glaucomatous changes with deep cup and with deep cup. Okay. Pressure in both eyes was 24 mmHg. Central corneal thickness in right eye was 486 micron, in left eye was 455 microns. Corrected IOP in right eye 28 mmHg and in left eye was 30 mmHg. On gonioscopy, all angle was closed. We could see the double hump sign and 360-degree peripheral anterior synechiae was present. On biometry, axial length in right eye was 16.95 mm, in left eye was 16.91 mm. Anterior chamber depth in right eye 2.05 mm, 2.09 mm in the left eye. Lens thickness 3.52 mm in the right eye and 3.18 mm in the left eye. Lens axial factor in the right eye was 0.20, in left eye was 0.18. Keratometry, K1 value in the right eye was 48.50 diopters, in left eye was 48.25 diopters. K2 was 50 diopters in the right eye, and in left eye it was 50.50 diopters. Anterior segment OCT was done, which was suggestive of plateau virus. Perimetry was done, which showed generalized reduction of the visual fields. So the diagnosis could be both eye primary angle closure glaucoma with nanophthalmos with plateau iris syndrome, and left eye trabeculectomy was planned for the patient. This is unique. As we all know, plateau iris syndrome is a bit uncommon, and its occurrence in the nanophthalmic eye is even rarer, making this case highly unusual. While primary angle closure in nanophthalmos is often due to pupillary block, this case highlights a non-pupillary block mechanism, emphasizing the importance of gonioscopy and anterior segment OCT. Clinically, it is important to suspect plateau iris syndrome if the peripheral anterior chamber is shallow despite a patent PI, or if there is a high plateau iris configuration on gonioscopy, or if there has been an angle closure glaucoma crisis despite a patent PI. It requires gonioscopy and anterior segment OCT for diagnosis. Differential diagnosis includes imperforate or occluded iridotomy with persistent pupillary block, multiple cysts of the iris or ciliary body, ciliary block glaucoma, open angle glaucoma with anatomically narrow angles. So the take home message is, it is a complex, sight-threatening condition requiring early identification, long-term monitoring, and often surgical intervention to prevent irreversible vision loss. Thank you.
You said it requires just one question. You require gonioscopy and
Meanwhile, the
AIOS
next
to make
speaker can come on this
diagnosis of
podium.
plateau iris. Will you like to modify your statement? AIOS, because the mechanism is the rotation of the ciliary processes, and with AIOS you cannot go behind the iris and ciliary body.
Yes, sir.
So I think you need to modify that
Sir,
statement.
we can also, on gonioscopy, we can see the closed angles.
Gonioscopy is okay.
Yes, sir.
Gonioscopy is okay.
Ultrasound biomicroscopy can also be done.
But you did not mention.
Yes.
You mentioned AIOS.
Yes,
So I
sir.
want to correct, because that should not be the message.
Yes, sir.
Which should go that you require AIOS to make diagnosis of plateau iris. That is factually incorrect.
Yes, sir.
Okay.
So it is basically a clinical diagnosis, and nanophthalmos itself is a very complex
this thing. So it's another ball game altogether. Thank you for the presentation.